Greetings to everyone. We are the team MedTech Titans introducing the groundbreaking solution addressing the SIH problem statement 1383, optimizing doctor availability and appointment allocation in hospitals through digital technology and AI integration. With our cutting edge recommendation system, you can now swiftly book appointments, placing your well being and your valuable time at the core.
Now, we will be explaining our appointment booking system in action. When a patient wishes to book an appointment, they have the option to search for a specific specialist, browse a list of doctors with a particular specialization, or view all available doctors within their preferred time slot and preferred location. Once a patient has successfully booked an appointment, both the doctor and the patient will receive timely notifications regarding the appointment schedule, ensuring a seamless and organized healthcare experience.
In the event a patient decides to cancel the appointment, a partial amount will be deducted and the remaining sum will be promptly refunded. Following the cancellation, the slot becomes available. A notification is sent to the next patient, offering the opportunity to reschedule their appointment to an earlier time. If the next patient chooses not to opt for the earlier slot, a notification is sent to the subsequent patient. This process continues iteratively until the slot is either taken by a patient or until the end of the consultation time, ensuring maximum utilization of appointment slots and minimizing waiting times for patients.
Doctors are initially prompted to grant permission for the app to track their location. This feature is crucial to address unforeseen circumstances where a doctor needs to cancel their appointments. If the permission is granted, the system automatically updates based on the doctor's location. If not, the doctor can either manually update the system or use a QR scanner to update the status.
Now we will be seeing what patients can do with the application. Patients can view medical records, receive medical reports in simple terms, schedule appointments with doctors, and use the application for various services. When the patients schedule appointments with doctors, the system gets updated. Once the system is updated, all patients waiting for their consultations are promptly notified about their appointments, either being cancelled or being booked. Leveraging the app's capability to store patients' previous visit information and give preference to the patient's choice, a context-based filtering mechanism suggests alternative available doctors for that specific time slot, optimizing the scheduling process and ensuring continuity of care for the patients. After a consultation concludes, the doctor's prescription is dispatched to the pharmacy. This streamlines the process for patients, minimizing their wait time at the pharmacy and ensuring swift access to prescribed medicines.
Moreover, a proposed system facilitates seamless collaboration between hospital and labs. This can significantly reduce unnecessary show up by the patients, especially those who visit a doctor just to get their lab results and reports. Upon reviewing the lab reports, if the doctor determines the need for further consultation, a notification is sent to the patient to book an appointment. Alternatively, if a physical appointment isn't necessary, the doctor conveys the results and prescribes medicines through a speech based message, which is promptly delivered to the patient. The medicines prescribed are shared with the pharmacy in a tie up, facilitating direct delivery of medicines to the patient from the pharmacy. This approach ensures efficient communication and enhances patient care.
The app features a proactive mechanism that automatically sends regular checkup notifications to patients based on their previous lab visits. Leveraging the stored visit history, the app intelligently calculates and sends timely reminders for follow-up appointments, screenings, or consultations. This not only ensures that patients stay on track with their healthcare routines, but also promotes a proactive approach to managing their well-being.
In case of an emergency, our app swiftly provides the patient with a list of hospitals prioritized by the maximum number of available beds. The user, either the patient or the caretaker, has the option to call the hospital and request for ambulance services or directly proceed to the hospital for immediate care. This feature ensures that patients in urgent need can access medical assistance promptly, facilitating quick decision making during critical situations. It optimizes the healthcare seeking process, potentially leading to quicker treatment, reduced waiting times, and ultimately potentially saving lives by expediting emergency medical care.
Now, we will be explaining our recommendation system, which uses context-based filtering for analyzing specific contextual details to tailor recommendations or actions accordingly. In this scenario, it means considering various factors such as the patient's medical history, preferences, and the reasons for the appointment cancellation. The system uses this information to provide personalized suggestions for rescheduling and optimizing the patient's healthcare experience. The context of scheduling another appointment after a doctor cancels. The system leverages the patient's historical health data, including their medical conditions and prior appointments. It also considers their preferred medical specialties and available time slots. By analyzing these specifics, the system intelligently filters and suggests alternative doctors or time slots that align with the patient's medical context. This ensures that the rescheduled appointment is relevant to the patient's need. So context-based filtering is based upon decision tree, which is a graphical representation of decision making using a tree-like model. It consists of nodes that represent decisions, branches that denote the outcomes of those decisions, and leaf nodes that represent the end result or a class label. In the context of checking slot availability based on a patient's need, a decision tree would start with a decision node asking a relevant question about the patient's requirements, and based on the patient's responses, it would traverse through branches to reach a suitable time slot that meets the criteria.
Now we'll be looking at a working demo of our recommendation system. In order to book an appointment, the book an appointment button has to be first clicked. Once the button is clicked, all the prescribed doctors and all the time slots will be displayed to the user. In order to choose a particular location or a particular doctor, the user has to click the particular location button, and by clicking a particular location, all the doctors in that particular location will be displayed to the user. In order to choose the doctor for a particular time slot, that slot has to be first clicked. And on clicking that button, the confirm appointment option will be displayed. And on clicking the confirm appointment option, the appointment gets confirmed. On emergency cases, by clicking onto the emergency options button, the patient can either call the hospital or they can directly proceed to the hospital without any prior notification.
Now, these are the benefits that we get using AI integration for our system. Improved appointment allocation, staff communication and resource allocation, and real-time adjustments.
In summary, the proposed solution showcases a comprehensive approach to enhance patient experiences and streamline healthcare services. Utilizing decision trees and context-based filtering significantly reduces waiting times by efficiently matching patients with suitable appointment slots. Integration with pharmacy and lab facilities, along with tailored recommendation systems based on patient preferences, further amplifies efficiency. Additionally, the system's provision of regular checkup reminders ensure proactive healthcare management, ultimately promoting a patient-centric and optimized healthcare journey. Thank you.
Thank you.